Everybody, it's Matt and Dyan. Welcome back to OK Aussie. Come shop with me. No, not quite what you think.
Come
this
shop with me.
Is a pharmacy shopping haul. I wanted to show you what a week, well, sometimes only 2 or 3 days. I've been down to the pharmacy.
This is a fortnight.
I've actually got to go back in probably another 3 or 4 days. Every week, I'm going back for more and more. This is what a life with a complex medical household is actually like when persons with disability.
You've seen the trolley. Look at this.
Genetic rare conditions.
I mean, it's insane.
This is Dyan's go-to what's quickly accessed. As you're saying about the trolley, we've got a medical trolley, emergency trolley over there. We've got a full cupboard of medical stuff.
If you're medically complex and you go, oh, I need a trolley, what a good idea.
And you've also got a cat.
IKEA.
You grab him because I'm going to actually open up these and go through this. So I wanted to share where everything goes and what everything is, and
he scratched me.
Just the cost of all this, because every country is also very, very different. We'll keep that receipt together as I open these up. But I want you to
yeah, that's true. With medicine costs and what
gets
covered by your insurance or by us, it's by
could they get a smaller bottle?
Government.
I mean, that's it. Could they have found a smaller bottle?
What would happen if I took them all?
You'd be a fish, as far as fish will go.
I'd be a mermaid.
Oh, there we go. There's a mermaid access.
Mermaids don't eat fish.
She apologised she couldn't fit it all into the one bag.
Very loud.
No, she couldn't fit it all into the one bag. This is a lot. So.
Sorry. So you had to do 3. Oh gosh, we're still going.
Still going. Sorry.
Okay.
Not my fault. You've got so many things to deal with.
And now we broke.
Well,
$76.
Yeah.
And $111. Oh,
yeah.
111. Isn't that luck?
Yeah.
Angel luck?
Hold on. Sorry, that's my medicine.
Wow, that explains
that goes in the cup. Hey, in case I'm diabetic, I need a glucose. I'm ready to go.
111 plus 76 is...
It's only $2.35.
Anyway.
Give me a break. Okay, so...
Yeah, the rest of it's mine.
Oh, God, where does one start? But there's been actually some interesting conversations, because I had a conversation with one of my favourite pharmacists at Pharmacy 777. That's local to us in Applecross. There's a beautiful team there. They all know me.
Love them.
They certainly know me. They see us regularly. We do compounding as well, because some of the medications that you get have to be specifically made up to dosages that you can't get over the counter. Interesting.
Because I have like a horse tranquilizer because I'm autistic, and also
put you to sleep, yes.
22q has caused calcification. I've got it hip, boob,
you got calcification spots everywhere
in my brain,
and it is something to look out for. Is
tumors.
Calcification for patients with 22q.
Dyan's
got a rare genetic chromosomal condition called 22q11.2 deletion syndrome.
The area of sleep. The reason why I didn't grow, the reason why I can't sleep, is the calcification in there.
Yes, it doesn't help you at all. Now, look, sometimes we do use iHerb online from other states to get things. Yeah, well, let me just talk about this very quickly, because I don't want to be too long on this, but I'm going to explain some of the things around this. Now, first of all, the fish oil. Fish oil will be one of those things that we'd normally get from iHerb over in the States, because it is a lot more cost effective for supplements, your vitamins and supplements, right?
We need to get back into that pattern.
But you've got to buy a certain amount of order to get the value for the free shipping. And we're pretty well stocked up for the vitamins that you need. It's just occasional ones that blow up. So this is why I got this one. They didn't have a smaller bottle, seriously. This is a 400 capsules of the 300 milligrams of omega-3 fish oil. It's really good for your brain, heart, skin, eyes, and all that sort of stuff. Very, very important.
I take it every day, guys.
You take it every day. It's a requirement as part of that. But this was something like $45, but this is going to last you a year's worth. I know, right? I know, right? But I want to put this in context of what some of these things cost. So
now it's adding up.
Yep, now it's adding up. That's $45.98. Okay, so that's the first thing. Now,
adding up.
Okay, let me go through this quickly. Dyan has some difficulties with swallowing tablets. You've seen this when she's having emergencies, particularly around dystonia.
Well, when I get neurologically drunk,
offline.
I call it neurologically drunk.
The brain's not working.
Meaning I don't have full control over my body. So picture yourself passing out and you're losing control of... You're still hearing everything, but you're losing control. You can't swallow.
Correct.
You can't go, brain, swallow. It doesn't happen.
Funny about that, isn't it?
Yes.
So we're looking at some options, and here's one of the most funniest, stupidest, insanely frustrating things. You know the clonazepam that you take, the 2 milligram tablet?
No, but I just take the tablets in here.
Right, but you also take PRN tablets.
I'm not allowed to take tablets, so I don't know.
So the clonazepam, I'm going to explain this very quickly. So the clonazepam is
my license got taken away to take my own meds by my neuroscientist.
Sure. So the clonazepam is the muscle relaxant medication that I give you as your first step emergency medication for when you're having dystonia and seizures or severe Tourette's attacks. Okay. That's a little tablet.
That's a twofer.
But Dyan really struggles when she's in those phases with the dysphagia to be able to swallow, and that becomes a choking and
my brain. I've got no control on my body. I can't go. Oh, just swallow. I'm not quite there.
So I had a good conversation with the pharmacist. Yeah. Did you know that the clonazepam that we buy, even though it's on the PBS to a certain level, there's still a gap fee, and the gap fee is about $35 every time I buy those tablets for you, right? So it's not really on the PBS, okay? It's a reduced cost, but it's still a gap fee. $35 every time I buy that bottle of tablets. The liquid version of clonazepam is fully on the PBS. There's no gap fee.
What is?
The liquid version of it. So there'll be no cost by having the liquid version compared to having the tablet version of the same. Now I haven't got it here. That's got to be organised. Because I can't use the same script, even though it's called clonazepam liquid, I can't use a clonazepam tablet script to get a clonazepam liquid. Doctor's on holidays for 6 weeks. But when he's back, that's okay. We'll arrange that. Because it's smarter. It makes more sense. First of all, it's more cost effective, but it's better delivery as a liquid.
Like this government,
she won't choke and die. Let's keep going.
And specialists don't want to see me often because I'm an adult.
Now, speaking of being an adult, most of the liquid medications are for the kiddies.
Yeah.
Sorry, but they are. So, Nurofen for children is actually, did you know, Nurofen for adults. It shouldn't actually say Nurofen for children because the exact same dosage is what's actually used for adults. 200 milligrams is the amount of Nurofen that you get as an adult in 5 mils dosage. So, it's actually Nurofen for anybody, children or kids. But they market it.
Because I was thinking of elderly and people like me.
$25.98.
Because I get febrile seizures, guys. Yeah. This is because of the febrile seizures, meaning what he does when I'm obviously, I guess when you do it when I'm not responding or not. I don't know what when your temperature's like in that position. Oh my goodness! But I'm just saying he can squirt that into my mouth, and hopefully it'll eventually go down. Because I know with my focal aware, I can be like, it just sits down here or at the back of my throat,
28,
and I
29,
can't swallow.
30-degree temperatures.
Yeah. So
being febrile,
that's
warm,
why. So
having fevers.
Speak to your doctor about if you need this method, and this sounds like, oh, that's interesting. I might do that. Speak to your doctor first, because we are not medical professionals.
No, and that's the whole conversation. This is about us as a family and done with multiple rare genetic conditions. How she has to deal with it. So I was also going to say you've got the Nurofen in a liquid format, but we've also got the Panadol. Or as they call it, Panamax. It's equivalent to the Panadol Osteo, but again, it's another one that you struggle with. Exactly. Yeah, Panamax. Panamax is only the adult version. Otherwise, all the Panadol ones are for the children.
Yeah, Panadol liquid.
And you've got to then look at the dosage levels.
We didn't have this for our kids.
No, and because you've got to look at the dosage levels, you've got to look at a lot more volume in a syringe to be able to give. And that means a lot more volume for you to have to actually swallow. So I want to have a small amount of volume. So again, that you're not struggling with aspiration and mucking around, right?
Oh, no.
So that makes sense?
The good thing is I don't aspirate much on these types of liquids because they're quite jelly, gluey.
Exactly.
Whereas not clear fluids,
thin fluids.
Thin fluids, oh gosh, I'm struggling.
But that's why with dysphagia you have thickened fluids. So you add a thickener to soup and other drinks to make it better for swallowing.
I know
so you've now got Panadol in a liquid, you've got Nurofen in a liquid. You've already got your emergency medications, which is your midazolam in a liquid.
Do I get a jelly bean every time I do it?
If you're a good girl, I'll get you a jelly bean. That sounds good. The clonazepam will now get in a liquid. Now, look, you could get, and I know you looked at this one.
I actually do that, guys. For a sensory issue, when I take my liquid melatonin, the horse tranquilizer. The
horse tranquilizer,
it doesn't work. Yeah. The doctor goes, seriously? Now, he's been in medicine a long time, and
he still scratches his head about you.
At me.
Now the Panamax is $12.98. That's for I'm sorry, you can finish off 200 ml bottle.
He gets me a chewy and gives me like it's in a syringe.
Yep.
And he's got the chewy ready now. Yep. That's how much he knows my sensory problems.
Yep. I don't want to put up with sensory overload. That's okay. Being autistic
it's intense.
And trying to take medications.
There's alcohol in that.
There is.
Yes.
Yes.
I can taste
it. So $12.98 for the Panadol. The Nurofen $25.98. Now I could have got an antihistamine for you as a liquid.
My Phenergan.
But it's ridiculously, insanely expensive.
What is it cost now?
I'm not even going to bother going there. It's ridiculous.
That I don't get anything from the government. I have to pay outright for that.
$16.98 for
now, this is my sleep initiation tablet and allergy tablet.
Yep, so $16.98 for 50 tablets of Chemist Stone. So this is a Chemist brand, so it's cheaper than the actual brand name, such as Fanine. It does. It's the exactly same equivalent product. You've been using it for a while and you've been sleeping, or have you? I'm kidding. I'm kidding. She's been sleeping. It has been. Yes, it's the exact same product.
Because I had an autistic night the other night, had a pain night the other night that kept me up.
It's separate to all that. You've been on the other medication for months.
I'm going to check now.
I've been checking.
See,
don't you worry.
This. Him and the doctor. They go, just put it in there. Just don't say anything.
Until.
Right? And then ask us some questions.
Yep.
Now look, it's brilliant.
It does work
I don't think they should stop. And I wouldn't notice what tablet's what because I'm just. I'm brain damaged. Like when I said to him once, I said, why do I have my Tourette's so bad now? You know, I know I had it as a kid. I remember saying inappropriate things and had no control over it. Used to get into trouble all the time and couldn't stop. I didn't have the control. And I said, it's so bad now. You know, sometimes I can't go out. He's like, I said, what is it? He's like, it's brain damage.
Yeah, it is.
I was like, oh. But he's right. It's like, okay. So I wouldn't know. But it's a brilliant thing that you guys do that because it's a good experiment.
And that's what we're doing very safely and carefully to see. We only ever make changes one at a time. We don't want to change multiple variables at any time. We always start low
look at the tramadol.
And we go slow.
We microdose.
So for example,
you guys who are adults will get given 50 grams tablet of, you know, and you'll take it and you'll barely feel much.
50 grams, 100 grams,
you'll
200
be like,
grams.
oh yeah, it gets rid of the pain, but I'm fine. Me, I'm on the children's liquid, 3 drops, 3 milligrams can make me feel woozy. But the pain at least is gone for my high pain.
But you're so small in size and stature.
No, but it's the chemical sensitivity.
Of course, there's chemical sensitivity. I agree with that too. Now, talking about chemical sensitivity, we don't use the Nurofen every day. It's a no more than once every 3 day thing because it causes her to be more flexible, more poppy with her early loss, joints, sublux, and dislocate. So no more than once every 3 days. Whereas the Panamax,
EDS,
no problems.
Do not take anti-inflammatories. Do not, and don't take Nurofen.
Absolutely.
If you can avoid, look, you can do it like this occasionally. I would probably say once a week to a fortnight, really. But avoid it if you can. If you've got EDS.
The Ural daily supplements. These are cranberry, by the way. Okay, you can see the dosage of like 60,000.
Is that tablets?
No tablets. They're the ones that you take, the little red ones every day.
The little red pill.
The cute little red pill.
Love the little red pill. He makes me happy every morning, actually, because I look at him and I go, you're a beautiful colour. Everything else is white.
It's a pretty tablet.
Everything else is like weird colours, like green or whatever.
You can't choose the aesthetics of the colours. I know.
But this one's like this cute little round red pill.
It's shiny as well, isn't it? It's nice.
Kind of reminds me of Disney.
Okay, and that's not how you should think about it. But this obviously helps you with the UTI side of things. And when you have complex over 4 years, they don't go away long term.
Because I'm meant to be in hospital.
Infection based.
Liquid.
IV.
Intravenous
IVs. So $33.96 for those.
Broken. Broken.
Now, speaking of which, of course, when you're on antibiotics, there's the adverse reaction. For every reaction, there's an opposite reaction, and it causes candida and other sort of things as well. So you've got to be on the Caniston cream and the Caniston antifungal cream. Caniston cream for 6 days, $24.98. The Caniston Ultra or Extra, as they call it, $17.98. Goodness, know the cost of those.
I used to get for that. A cream that's like that's like.
It's a little instant.
You know how you get like a massive like shampoo or conditioner bottle?
Yes, I do understand that.
Price, and then you go get the travel one. Yeah. This is like the travel one, but the same price as the big one.
Yep.
Oh, come on. This is.
Let me go through some of the other things that you've got to have.
You pharmacists must be living the high life, man, and
Well,
they do say that the pharmacology, the big pharma, you're making a lot of money, man.
I think so. Jeez, if you want to go into a good industry,
become a pharmacist.
$16.48 for trimethoprim. That's 7 tablets for 7 days. That's one of your antibiotics, trimethoprim. So that's $16.48.
My body can't fight the infection, and I'm still getting fevers on those too.
Cephalexin.
But my doctor's on holiday.
$16.50. We have to take that 3 times a day, and that's a week's worth at 500 milligrams each tablet. So $16.50 for those.
And most people will be like,
and you'll have to be doing this for about another 4 or 5 weeks at least. No, 4 or 5 weeks.
I'm going to keep going.
Yes.
You get antibiotic resistance, guys, when you're like me. I've been on antibiotics since I was a child.
Yep.
All necessary. I have not overused them. If you're into that kind of belief, no. I've always taken it only because I know when it's an infection, because I've been suffering infection since I can remember.
Bingo. Glycerol tritonate, which is actually the nitrolingual or GTN spray for Dyan's heart, $26.42. It's a spray. Psst. Anytime that she gets the angina, the intense heart pain, now
and 2 or 3 sprays and it doesn't work, and heart rate's
straight to hospital.
And it's like,
do not pass go, move very quickly. Sadly, now what we are finding, the adverse of that is the more potassium that you're using, you're having significantly less heart-related issues, because the potassium stops those atrial flutters, contractions, and the angina pain. So we're on a win there. Now, the next one is the frutamide 40 milligrams. Normally $19.22. $19.22 for frutamide, which is a loop diuretic.
Or is that the normal price?
That's the normal price. I'm telling you those normal prices. Now, when I say normal prices,
I'm on this how many times a day? I mean,
you are on 80 milligrams, anywhere up to 120 milligrams, so you can be up to 3 of those a day. Exactly. Just to put context into that, because of the full body edema. Yep. Now, for seizures, you're on 3 of these a day. You should be on 6 a day, but we have to do for small body and size and everything else.
Microdosing too.
The sodium valproate, also known as Eplin. Now, this is normally $24.82.
No, but it depends on the weather.
Box.
I've already had to, every so many days, increase an extra tablet.
Yep.
Because I'm getting my migraines, which my migraines is a preictal, days before it's a preictal. So for me, now that the warm weather's already come, because it's in Perth, it's always instant. It's like freezing cold, boiling hot, no in between.
We've got 2 seasons, not 4 seasons, apparently, haven't we?
It's seizure season is coming.
Yep, hot weather always.
And basically, I've already started to up that every so many days.
Yeah. Now, that's one of those things where you're just underneath the level of therapeutic benefit.
Yeah.
To have more, though, causes more adverse reactions.
That's my chemical sensitivity.
Bingo. And
because
it causes other problems in your body.
But also, there's another reason, too. I would actually take more. And I know I do need more because I'm very neurologically... But because I'm an adult and I have the autonomy, I guess, to do it.
Choice and control, right?
And I've told my doctor this, so don't worry about it. If I take the actual dose, and it does prevent more than what the seizures I'm getting, but my daily mood is crap, guys. This makes you so irritable. And look, I've suffered this my whole life. I feel like, you know, the irritability and the anger outbursts that I've had is always medication based.
Yep, that's what
and then as soon as we reduce something like this, my mood is just fine. I'm not, because I am a natural happy-go-lucky person. I've got the chill gene, literally.
She literally does actually have the chill gene. It's a true thing.
Actually a thing. So it's not the normal me, guys. No. So when I take this, I don't feel like I'm myself.
No. Now that's very important to recognise, because finding the correct harmony, having everything in the harmonics of what's balanced,
because it is dangerous, but it is dangerous.
But if there's adverse reactions that affect your mental health or your mood stabilisation,
it's hard, right?
Then there's risks associated to that as well. Now, you mentioned migraines. The migraine medication, rizatriptane, max salt wafers, $27.20 for those. Now, there is a gap fee on the PBS, so they're not fully covered by the PBS. You still have to pay a gap of $4.80 to get those. So some of these medications are covered by the pharmaceutical benefit scheme, the PBS in Australia. When you hit a threshold, so they're reduced cost.
Thousands of dollars you've got to spend.
Once you hit the threshold, yes, then those medications for the rest of that calendar year are free.
How many thousands is it?
I can't even remember across the 2 of us. No, I can't remember. I literally can't remember what full price is.
It's thousands, guys.
It's ridiculous.
So you've got to spend a lot before you get it. But you know what?
Thank God it's there.
We get it. I'm glad it's there.
Yeah.
But you do have to pay a lot
on
to get it.
Certain medications. That doesn't include vitamins, supplements, liquid painkillers, sleep medications, and it doesn't cover any of the compounded medications that Dyan might need. Medicinal CBD, for example, compounded melatonin. So 1/3 of Dyan's medications, yes, these ones here are covered by the PBS. There are some gaps for some like those.
Not these.
And not those, not those, not those, not those, not those, not those. You get indication. I also have 2 sets of medications for blood pressure and my heart, because I've actually had a stint in my heart. I have a rare genetic anticoagulant. So that's why I ended up having 4 lots of renal infarctions. Lucky it ended up in my kidney rather than my brain, because I would have been dead in an instant. So I'm incredibly lucky, but it's a rare genetic condition that I have. So we share having rare conditions. We understand that. $16.50 for those ones.
That's a normal
$19.89 for those ones.
Right.
But in a household, I want you to take this in and think about, look at what we need these things. We have to live on these things. There's many other medications which I've already got because they're covering weeks and months. So you're not seeing the full picture. So imagine this as being like an iceberg. One quarter of the overall medications that we have to use to keep Dyan and myself covered. It's expensive being sick, isn't it?
That will last longer.
That's right. That one will last over a course of the year. But even with this, you're meant to use anywhere.
A quarter of a month is here.
2 to 3 tablets a day.
I would love to use 2 to 3, but I can't afford it.
We can't afford it. So we use 1 tablet, so we at least get some benefit, which will cover you for a year. But if you imagine if you use 2, it'll be half a year. If you use 3, it'll be a third of the year. I know. He's playing. Excuse me. What are you doing?
He's having a ball.
Oh, you are such a funny thing. This is our Max at the end of the day. He's loving it. He's happy that I've been to the pharmacy.
Sorry, I interrupted you.
No, that's okay. No problem at all. So anyway, guys, that was just a quick little snapshot just to show you a shopping haul, a pharmacy haul, what going to the chemist for a complicated medical household is actually like, and to give you some idea of the prices in Australia, because I'm sure they're different in Canada or the US or the UK.
Cabinet, guys. We have a cupboard dedicated to medicines.
I just want to quickly show you this, just so that you understand that. This whole thing here
makes it easy for you, doesn't it? And stuff.
Just to give you an idea, we are our own pharmacy as we go along. And even down here, we have got straps and catheterizations and nappies and all this sort of stuff. This is what life is. Everything is also clearly documented. We have processes and procedures around everything from medications to PRNs to when things are done. This is what being in a complex medical household is actually like. So guys, I hope you've enjoyed today's quick little insight into a chemist talk. What a horrible thing, a chemist talk. Do you have a chemist talk? How much do you pay? Is your prices different in the UK, in the US, in New Zealand, in Europe, anywhere in the world?
Anything to do with your medicines,
how do you cope with it all?
But I do want to say, if any medicines here you want to take, please consult with your doctor first.
Correct, and that's our thing too. Remember, we're not medical professionals. We're not here to guide you as to what you might need. That's what your GP, primary care physician or specialist are required. So go see them for treatment, diagnostic and management. We're here to share, educate and advocate for having rare conditions. But I'd love to know what it's like in your country about this. How comments,
much
questions,
you know, like
ideas, suggestions
like how you struggle with your medicines, or if you know, if you have it easier or if you have it harder.
And do you have a cat like this?
No.
Let me know.
He loves
our cat's broken. I'm sure he is.
Everything that's not his
Such
toys.
a weirdo.
Everything that's not his toys, he loves.
I know, right? Don't forget to give us a big up, a hype, thumbs up, and of course, if you're new to the channel, subscribe, hit the notification bell, and we'll see you.
Willow's awake.
Willow's awake. He's already had a brush this morning as well. We'll see you soon in another video. Bye guys.